Greetings to the University of South Alabama Cardiorespiratory Care, class of 2020. You are the 39th graduating class from the program, and with you there are nearly 500 alumni. You and your predecessors have made a significant impact on the respiratory health of the Gulf Coast region, Alabama, the country, and beyond. Thank you for putting your trust in the faculty to help shape you into the professionals you will become. Thanks also to the family members who have provided spiritual and financial support to your loved one in this endeavor. I also wish to thank the faculty and staff of the program, Mr. Bill Pruitt, Dr. David Shang, Dr. Philip Elmalouf, Ms. Jennifer McDaniels, and our secretary, Ms. Polly Garner, for their expertise and contributions. Bill is the consummate scheduler. He made sure you had the optimal clinical experiences and worked tirelessly to recruit and assure the competence of the clinical personnel you worked with. David provided you with the fundamental knowledge of physiology and provided an essential background in educational technique. This is important with the impending shortage of respiratory therapy faculty. You have the preparation to fill that need. And you must know that the preparation he provided you to take the NBRC exams is without peer. Dr. Elmalouf provided his perspectives on a number of disease states and the relationship between therapists and physicians. You all had a good clinical preparation in pediatrics with Jenny. Polly Garner kept everything on track for both the faculty and students. She is a great team player and responds to needs before they become needs. In this address, I will express my congratulations to those who have met the goal of passing the therapist multiple choice self-assessment examination and have been inducted into the honorary fraternities for allied health and respiratory care. I will recognize those who have been awarded the Deans and Chairs Awards, and maybe I'll be able to address some of the fears you've had about practicing in this rapidly changing climate. I will talk about the characteristics of a profession and professionals, then conclude with my charge to you. This is by design an address focused on you rather than a more generic group of graduates. This is the only commencement address you're likely to hear where the comments are so focused. As of late, all of you have passed the NBRC Therapist Multiple Choice, or TMC, self-assessment examination. This is important. Congratulations. Because of the high reliability of the self-assessment examination with that of the actual examination you'll take shortly after graduation. You are all now eligible to sit for the Therapist Multiple Choice, and with a high passing score on the Therapist Multiple Choice, you are eligible to sit for the clinical simulation examination. When you pass the clinical simulation examination, you'll be registered. You'll recall that this accomplishment was set before you as a goal on the very first day of your time with us. No doubt many of you will pass those examinations on the first try and will be registered within a few weeks. For others, it will take a bit more time, but I'm sure that all of you have the aptitude and intelligence to achieve this goal. I particularly want to recognize the scholastic achievements of some of the class of 2020. The recipient of the Dean's Award for Scholastic Achievement for achieving the highest GPA in cardiorespiratory care for the 4 years of his work here was Richard Smith. Congratulations, Richard. The Alabama Society for Respiratory Care awarded its Chairman's Award for Academic Excellence to Brianna Draper, and the award for Clinical Excellence went to Lauren Casanova. Again, congratulations. Ordinarily, these awards are made at a luncheon at the end of the spring semester, but in these extraordinary times, we have made those awards virtually and will schedule an event in the future to recognize these individuals personally. Lambda Beta is the respiratory therapy honorary fraternity. Students in the top 25% of the class are eligible for induction into Lambda Beta. This year's inductees were Alexi Abel, Kylie Badgett, Lauren Casanova, Mary Lyons, Kiara Marisette, and Richard Smith. The Allied Health Honorary is Alpha Eta. This year's inductees were Kylie Badgett, Lauren Casanova, and Richard Smith. The faculty and college administration are very proud of the academic accomplishments of these excellent students. You've been prepared to go out there and perform the role of the respiratory therapist. But what's it going to be like now? Some of you are already there, and you know it's different from what it was before late in February or early in March. You have said, it's scary. This all came so fast, and policies and procedures seemingly changed overnight. In early March, the program chairs were asked to determine what it would take to switch to a fully online teaching format. Then clinical sites started worrying about having students. Everyone worried about the shortage of personal protective equipment. So clinics were off again, then on again, then back off. From your perspective, I'm sure it was dizzying and confusing, but you stepped up to the plate and carried on, and for that we're very proud of you. And you should be proud of your ability to respond to such a stress. One thing in which we can be sure, or one thing we can be secure, is that you had completed your clinical competencies by the end of fall semester. What you had accomplished by the first half of this semester is that you were getting a foretaste of a full-time appointment as a therapist. You were able to work on senior projects, education course competencies, work some, and prepare for the self-assessment examinations. Infection control procedures have always been an important part of patient care and patient safety. Thousands of patients have died annually from neglect of infection control. Now it's a matter of life and death for us, our colleagues, the public, and patients. We hope we have hit the peak of the curve and are now on the downside. But that means that we must be vigilant and follow the advice of public health authorities and our hospital infection control experts. There has been and will be stress, but you are well prepared for the medical side of that. Preparing for the psychological side is difficult to predict. I suppose hospitals will realize this and respond accordingly. We've never had such a problem, so there will be attempts to allay your fears that you hope will work. It's a good time to know that there's evidence out there about how to handle that stress, and you know how to search the literature for possible techniques and remedies that may work for you and your colleagues. You will go to work, follow the prescribed procedures, and go home. We hope this scourge will pass, but all the uncertainties, such as a second wave or questions about immunity in those who had already been infected but survived, will linger. And so we prepare for the worst and hope for the best. Be informed. This is a seminal event in medicine. The things that hospitals, health plans, and providers are learning will stick, whether COVID goes away or not. You are on the leading edge of this change. So it's time to get out there and be the professionals you have been prepared to be. Being a professional means that you are a member of an occupation that has a scientific background and literature, which are the Respiratory Care Journal, clinical practice guidelines, and protocols. A group of professionals has an association. For us, the American Association for Respiratory Care. Be a contributing member. Run for office. Be on committees. Volunteer your time. You'll get out of it more than what you put into it. I know I have. A profession also has a code of ethics. For us, the AARC Code of Ethics. A profession carries out research. You have all completed a research project. You know the scientific method, and when you identify a clinical problem, you know how to investigate it. Don't shy away from that responsibility. Professions offer advanced degrees. I urge all of you to consider a master's degree option as soon as the opportunity presents itself. Such opportunities exist both at home and online. In conclusion, I charge you to tackle the challenges of the new realities in respiratory care and respiratory care practice. Not only do we have to respond to the current pandemic, our practice must rise to meet the challenges of an increasingly elderly population, shortages of healthcare personnel, accountability for patient safety, the impact of government regulation in healthcare, and the increasing use of healthcare technology. We'll need to continue to incorporate protocols and communication skills to serve as leaders in acute care and disease management. Never stop learning. The technology we work with today barely existed 20 years ago, and it will double in intricacy within a far shorter time period. We are uniquely qualified to meet these challenges within the healthcare system. I wish you all good luck with your credentialing examinations. You've been well prepared. I hope you'll all find good, rewarding positions in respiratory care, and I pray that you'll find respiratory care a lifelong career in the service of your fellow human beings. Stay safe.
My warmest greetings to the class of 2020. I want to tell you how proud I am with you for reaching this milestone. And at the same time, I want to share with you some thoughts on your transition from being a student to being a respiratory therapist. The transition is not going to be easy because the expectations of you from your employers will be much higher than you're used to. And my advice is get your credentials and earn your RRT credential as soon as possible. And even after you earn your credential, do not think a bachelor's degree in science and an RRT credential will bring you respect, because respect from other people comes from your hard work. You need to show people that you are hardworking, that you're a caring person, and you're willing to make the sacrifices to do things in addition to what you are asked to do. So the challenges are there, and I hope you will meet the challenges and be proud of yourself and make the profession proud of you. Only then the profession will advance to another level. For this, best of luck, and I look forward to hearing good things from you.
Well, good morning, good afternoon, good evening. I want to congratulate you on achieving your final goal of graduating from our bachelor's degree program in cardiorespiratory care. We have enjoyed having this class through the last 2 years of time. You have had a lot of changes thrown at you and a lot of challenges. A lot of unexpected things have happened. And it's been surprising sometimes. It's been a struggle for some of you, I think. We've all kind of worked together through a very interesting and hard time. And I appreciate your willingness and flexibility and being able to accomplish this final goal of reaching graduation. We've been very happy with this class. This has been one of the top classes I think I've worked with. You have done very well in your laboratories, in your simulations, in your classroom work and exams, and you've also done very well in clinical. I wanted to tell you all that I've had many compliments coming from the hospitals as the respiratory therapists who've been there working with you as preceptors have been very complimentary of this class. They have been impressed with your work ethic, with your skills and knowledge, and with your professionalism. I appreciate the work that you've all done at the hospitals and through the times that we've worked with you, Victory Clinic and other places. And we have really been impressed. This has been a great class to work with. I wish all of you well as you move forward in your careers. And I expect, and we all expect, that this whole class will become registered respiratory therapists. I don't have any doubt that you'll be able to achieve this. You know what's coming up on the exams, and you may have one or two times or whatever to try and make it through. Some of you may make it on the very first time. We always see this happen with the classes that we've had in the past, but I have full confidence that all of you will be able to achieve that higher credential of the registered respiratory therapist. We want to say that you've done a good job. I really have enjoyed having you through this time and been impressed with many of you as we've worked through getting you to where you need to be. So we wish you well. I hope you have a great celebration for this achievement of your bachelor's degree. We look forward to hearing a lot of things come from you as this class moves forward. I expect we'll hear some really good achievements and some great things coming from this group. You guys have been a very good class to work with, and under the circumstances, you've risen to the occasion and have been able to achieve what you needed to do. I think we've all learned in this process that things sometimes take a turn that you can't expect, but you've learned how to be flexible. You've learned how to dig through things that you needed to learn and do. You've been able to achieve and accomplish a lot. So I have full assurance that you'll do well. So again, congratulations on reaching this final point to be able to graduate from the University of South Alabama as the final class from the cardiorespiratory care program. I think you've done a great job, and we appreciate all your work and look forward again to seeing great things come from this class. So as you move forward and go out into the field and begin to work as a respiratory therapist, remember us. I hope fondly, and we will fondly remember you. And again, I want to say thank you and congratulations.